How often does CLL transform into Richter's syndrome? Imagine living with chronic lymphocytic leukemia and wondering if your disease might suddenly change course. That's what many patients ask about when they hear about Richter's syndrome. In reality, the transformation from chronic lymphocytic leukemia to Richter's syndrome happens in a small but important number of cases. Studies show that about 2 to 10% of people with chronic lymphocytic leukemia will experience this change during their disease course. When looking at it year by year, the risk is roughly 0.5% to 1% annually. Richter's syndrome is a serious complication where the usually slow-growing leukemia suddenly becomes a more aggressive form of lymphoma. Most often, it turns into diffuse large B-cell lymphoma, which is a fast-growing type of non-Hodgkin lymphoma. Sometimes, it can develop into Hodgkin lymphoma or other T-cell lymphomas, but these are less common. The syndrome was first described by a doctor named Maurice Richter in the late 1920s, and the term Richter's transformation was officially used in the 1960s after more cases were studied. This transformation is significant because it usually means a poorer outlook for the patient. The median survival after Richter's syndrome is about 10 to 13 months, although some patients may do better depending on their overall health and how they respond to treatment. Certain factors can increase the risk of transformation, such as having large lymph nodes, enlarged spleen or liver, advanced disease stage, low platelet counts, or high levels of beta-2 microglobulin in the blood. Patients who have already undergone multiple treatments for CLL are also more likely to experience this change. Interestingly, the risk of Richter's transformation has not changed much with new targeted therapies introduced in recent years. However, some evidence suggests that patients treated with newer targeted drugs since 2014 may have a slightly lower chance of transformation compared to those treated with traditional chemotherapy and immunotherapy. When the transformation occurs, most cases become diffuse large B-cell lymphoma, which is aggressive but treatable. In some cases, the disease transforms into Hodgkin lymphoma, which tends to have a better prognosis. Patients with Hodgkin transformation often respond well to standard treatments, with many surviving several years after diagnosis. Understanding how chronic lymphocytic leukemia can suddenly become more aggressive highlights the importance of regular monitoring and personalized care. It reminds us that each patient's disease can behave differently, and staying vigilant for signs of progression is key. If you or someone you know has CLL, it's essential to work closely with healthcare professionals to watch for any changes and discuss the best treatment options. Always remember, medical advances continue to improve outcomes, and individual care plans are vital for managing this complex disease.